Stakeholders have called for equal access to HIV services while prioritizing youths in HIV response to end AIDS. They made the call in Abuja at an event to commemorate the 2022 World AIDS Day organized by AIDS Healthcare Foundation in collaboration with various stakeholders. The stakeholders include UNAIDS, NACA, UNICEF, Association of Positive Youths, Positive Access for Treatment Access, and Association of Women Living with HIV/AIDS in Nigeria. Dr. Eche Ijeze, Country Program Director of AHF Nigeria, said the 2022 global theme was selected to highlight the need for equal access to treatment and prevention for everyone.
AIDS Healthcare Foundation is lending its voice to that by saying it's over. So we want to ensure that there's equal access, inequalities are eradicated, whatever barriers are there are removed, and everyone can access care and treatment services. And we're still reminding the general population and everyone that HIV/AIDS is still here with us. And lots of successes have been made, and we sincerely want to thank all the relevant stakeholders who have played a significant role in ensuring that there has been a significant downward trend in HIV in Nigeria.
Dr. Victoria Isiramen, Health Manager in charge of Adolescent Health and HIV Program in UNICEF Nigeria, stressed the need to prioritize adolescents and young people in the HIV response in Nigeria.
Because we have about 70 million of this group of people in Nigeria, and that is a huge population. And so if we can, and they have a peculiar character. Their characteristics are very peculiar. They are young, they are growing, they are in their behavior formulation stage. They need to develop in a proper way. They need to be skilled. They need to be empowered. This is their formative years. So if we want a generation and a future that is secured, then we need to invest in these young people.
The Strategic Information Administrator of UNAIDS said the theme of the event, Equalize to End AIDS, was chosen to give everyone a chance to access their health rights, HIV prevention and access to treatment.
Equalize means also identifying different barriers and removing them for people to access all these programs. Because today we have all the tools, we have the technology, we have science have been proven that treatment is effective and can suppress the virus. So there is no need today to have new infections.
Dr. Daniel Ndukwe, Deputy Director, Prevention and Social Behavior Change Communicator in NACA, stressed that women were more vulnerable to HIV due to their biological makeup as well as socio-cultural factors.
The woman is, for example, less empowered. The woman is not so much empowered to negotiate safe sex. The woman might need the permission of the man to even go to the facility. The woman might have a man who's infected or hide it, but the day they discover you're infected, they say, no, I don't want the relationship anymore. So
the coordinator of Girls Act, Ms. Patience Asha, had this to say.
Today we are meeting with other organizations, with other young people to debate and talk on how we can fight HIV and AIDS. And this year team says it's not over, meaning young people, we still have a lot of things to do. We still need to advocate, we still need to spread the word and let people know that HIV is not a killer disease and you can be anything you want to be. It's not over.
Highlights of the event include dances, quiz, presentations and dialogue by youth groups in the FCT.